Okay, so for, listening to the heart sounds, you're usually going to use the diaphragm of the stethoscope. And what you'll do, you're going to try to listen for normal heart sounds. You want to listen to the lub-dub. Those are the two normal heart sounds that you should hear. And you want to listen to the four main heart valve areas, which are the aortic, the pulmonary, tricuspid, and mitral valve areas. And then you also want to see if you could hear like any clicks or heart murmurs. So I would check, the aortic, the pulmonary, tricuspid, mitral valves. And then, so I would find nothing abnormal. So I would document. And then for auscultating lung sounds, so I would use my stethoscope for this also, and I'm going to try and listen to see if there's any crackles, if there's any wheezing. I also want to hear, I want to hear if there's any like abnormal sounds, and I'm going to, with the bell of my stethoscope, I'm going to auscultate 8 times. Then with my patient sitting up, I'm going to use the bell of my stethoscope, and I'm going to do it on their back again. And I'm listening again for wheezing or cackling or anything abnormal. Make sure that everything sounds good. And finally, the next skill I'm going to be going over is the neurological exam, and checking the 12 nerves that come from the brain, stem from the spinal cord. So, you want to check the patient's mental status. You want to, ask the patient questions. You want to measure their awareness and their interactions with the environment. You want to ask them who they are, what time it is, the place that they're at. You want to observe that they have clear speech and they make sense. You want to check motor function and balance. This could be tested by having the patient push and pull against the hands of, you, the primary, well, not you, the primary care provider, but you're going to be doing that. And then you could check the sensory exams. You can do sensory tests. You can do this by tuning forks, alcohol swabs, or other things. Touch the patient's legs or arms or other parts to see if they could identify sensation. And then to do it with like an infant, usually they'll blink to like light or whatever. Or, you could place them on their stomach to see if they'll crawl. And another way you could check like reflex, you can tap the knee and so on and so forth. There's like a long list of things that you could do to check the neurological exam. It's just important, you check the 12 you want to check the 12 nerves. And that would be it for auscultating heart sounds, lung sounds, and performing the neurological exam.